Hello, my name is Michael Kidd. I'm Deputy Chief Medical Officer at the Department of Health in Canberra. Today I'd like to start with a message for everybody who's been delaying seeking medical advice. We know that throughout the pandemic, and especially for those who've been in lockdown, that many people have put off going to see their doctor, going to get their regular checkups for chronic health conditions or mental health concerns, and delaying many of the preventive measures which we should be doing, our regular immunisations and checks, especially for cancer, the bowel cancer screening, the breast cancer screening, the cervical cancer screening. So if you have had new symptoms, or if you're due to have a follow-up or a preventive health check, please arrange to do that today. No matter where you are in Australia, it's safe to visit your GP. And if you don't feel comfortable travelling to go and get one of these checks done, then please reach out using telehealth to your chosen GP or to your other healthcare providers.
Question 1. Is it safe to visit public spaces such as dog parks right now?
Well, it depends where you are in the country. So clearly those who are currently living under restrictions have to follow the guidance and the requirements of the state or the region where you're living. But for most of Australia, our public parks, including our dog parks, are now open. And these are places where we can go to get exercise and to enjoy time with our family and friends. But just like in every other part of our lives, it's really important that we're adhering to the physical distancing measures. So please maintain your distance from other people. Please make sure that you're doing your normal things with your hand hygiene and your cough and sneeze etiquette. Please, if you see crowds, stay away from crowds because it's much more difficult to maintain the physical distancing in a crowd. And if you are unwell, please stay at home. Arrange to get tested. And this way our public places are safe places for all of us.
Question 2. Is there an average recovery time for COVID-19?
That's a really good question, and it depends on how severe the illness is that people experience if they become infected with COVID-19. We know about 80% of people experience mild to moderate symptoms of COVID-19, and they can be managed at home with symptomatic relief and with advice from their local GP. About 10 to 15% of people get much more severe disease, and these people may end up being in hospital. And about 5% of people can become really critically ill, and COVID-19 can be life-threatening. Now, it depends on how severe the illness is as to how long you can expect symptoms to continue. With mild to moderate symptoms, many people are feeling back to normal within a couple of weeks. For those who become more severely unwell, it can take a couple of months before they're starting to feel better. And for those who end up in intensive care units and who are really unwell, it can take a year or more before people feel fully recovered. Unfortunately, though, everybody, no matter how mild their symptoms, is at risk of developing longer-term health problems related to COVID-19. We do know that many people, even if they've had mild illness, can still be experiencing tiredness and fatigue for weeks or months after they've recovered. And so this is why, another reason why it's important that we reduce the number of people who contract COVID-19 in our community, because we want to keep everyone as safe and well as possible.
And finally, if it's a respiratory virus, why is a headache one of the symptoms?
Well, headache is often a symptom when people have respiratory infections. Sometimes the headache is directly related to the virus itself. Sometimes the headache can be related to the dehydration, which comes when people have a fever and are not keeping their fluids up. So it's why it's important if you do have COVID-19, just like if you have a cold or the flu, that you keep up your fluids and that you get plenty of rest. And hopefully this will keep headaches at bay. Headaches can also be related to inflammation of the sinuses, which is one of the consequences of COVID-19 in some people. And some people who have serious illness from COVID-19, the virus can actually affect other body organs, and that includes affecting the brain, which can lead to very severe headache. So if you develop sudden onset of headache, it may be that this could be a symptom of COVID-19. So reach out to your GP and get some advice about whether you need to get tested. Let's do all we can to keep ourselves and each other as well as we can and as safe as we can during the pandemic. Thank you.